So, Dorothea, you've been my dear patient for the past couple of years, and you came to me with pretty severe Achilles tendonitis, like what, over 3 years ago, right?
Correct.
And I mean, we can look it up, but you're here for an opposite foot for a different problem.
Right.
But the reason why I'm doing your testimony today is because you're one of the first patients that I did that Achilles tendon repair with amniox, the Tenex,
Yes.
the new technology. And I think the only reason why I was brave enough to offer it to you is because you were a friend of a friend. And I told you, since you're a retired nurse, I said, listen, we can open you up. We can definitely do the old-fashioned procedure, or we can try this. And if it doesn't work, then we'll open you up anyway.
Right.
Well, and you were what, 3 years later?
3 years out, and I am 100%. It healed with absolutely no problem, and I had spent previously about 6 weeks in a boot trying to heal.
Right.
And we went from 2 tears to 5 tears.
Right.
And I had the surgery.
Right.
But it was all the things as instructed, and the results were absolutely marvelous. And 100% pain-free. All these years later, I can walk on sand. I can do loose surfaces with no issue whatsoever.
Good. Well, I mean, that's why I think you were such a great example, because you were one of my first ones. It's like first baby, right? You never forget.
And I'm glad that you tried that. I mean, you explained it all to me, and I knew that I'd have to have the more surgery if it didn't work, and open surgery. But this was a perfect time that this worked, and it worked marvelously. There was no issue. And as far as having any long-term pain post-op, just isn't. It was wonderful.
Well, because with an open surgery, you're in a wheelchair for 4 to 6 weeks, and then you limp for about 6 months.
Versus a Neil Walker in a couple of weeks.
Right, and like not really a real incision, right?
Right.
So, no, absolutely. Well, thank you very much for the testimony.
No, thank you very much.
You know, I didn't expect to see you back, but I guess with the opposite foot, right? But one